viewers, welcome to Silent Conversations with Miss Nkatha. I am your host, Miss Nkatha Mwenda, and I wear many hats. I'm a recovery coach trained by NACADA, a nutritionist by profession, chairperson of Graceful Youth Recovery Centre, which is a youth-driven organization at the forefront in prevention, a partner at Olonana Nkera Treatment Centre that offers an inpatient holistic approach to treatment of substance use disorders and mental health disorders with a team of professionals here in Kenya, in Kiambu. And today, I'm so honored and privileged because our guest is an expert in the field that we speak about in the area of substance use. Many people are asking, how can you be a professional? They keep hearing of all these positions and trainings. And well, today we do have a counseling psychologist. She is the president of an international professional body, and she will introduce herself. And I'm so glad that you're here with us, Dr. Pamela Kaithuru. Welcome to the show.
Thank you. I truly appreciate it. My name is Dr. Pamela Kaithuru. At times I use Rosalind Kirote. They are all my names, if you find them there. I'm a psychologist, mental health expert, a climate scientist as well. At times people wonder how these combine together. Currently the president, International Society for Substance Use Prevention Professionals, that is ISSUP-KENYA. I also take a lot of research in terms of mental health, substance use, and also climate change. Currently also volunteering as a psychologist, consultant psychologist for African Coalition of Communities Responsive to Climate Change. Besides being an employee of the government, I work for the Kenya Met Department at the training school. We have a training school that trains professionals in meteorology, and we need a lot of you Kenyans out there to learn meteorology, because you know that today climate change is a big challenge. The more we get people understanding, the more we get people who are professionally qualified, then we will be able to prevent the impacts of climate, especially to the communities. I also serve in the church, besides being a parent. I support various counseling institutions as well in supervision. I supervise counselors. I also supervise students in some universities. So it's a lot of those things there, personal development and giving back to the community, because the most important thing is what solution do you provide to the world. So I endeavor to be a solution giver to the issues of life. So mentoring for me is an area that I really want to ensure that there are people that have passed this information to, they can take the baton and run. The world is quite big and the needs are many. We cannot be everywhere. So the many people we build their capacity, the better. I have capacity also in policy development. I've participated in developing various policies, especially in counseling, substance use, HIV, an area that I have worked in for long. I started working in the space of HIV in 2003. I also advocate and have supported a lot in HIV prevention, besides substance use issues, of course, the relationship and bi-directional relationship. I've also been able to author some books, motivation books, Christian literature. I've written also in international publications that are out there that we can be able to access. And I believe that this is just a tip of the iceberg. Several things in many forums.
Wow. Oh, wow, Dr. Pamela. Climate action, met mental health, HIV. Wow, I'm so curious to understand where all this started. Just give us a little more information about yourself. Maybe even a little where you grew up, how you got into your area of profession or expertise. Then I like the way everything gels into mental health, because I also watch your channel, Mental Health Hub, and you have quite good content on different topics, not only on substance use. Yeah, so tell us where it all began.
Okay. This girl grew in Meru.
Okay. Murima.
I was born and bred in Meru.
Yes.
Born of teachers. My parents, all of them were teachers. They are now retired and doing a lot of community work out there.
Yes.
Studied secondary level, of course. I did the A level. That's how old I am. If you hear A level, you know where people. The last class was.
You know, they're called floors.
Yeah.
The fifth floor.
Tumefika karibu sixth floor. After that, I was taken in by the district focus. Then government was employing through district focus. That's how I joined the Kenya Med Department, the meteorological department, with a diploma.
Yes.
I have worked there since then.
Wow.
1990.
Yeah.
Then, of course, as at the workplace,
Yes.
issues were happening. 1990, the late 80s were a bit turbulent in workplaces because of HIV.
Oh,
HIV
yes.
was a real challenge.
Yes.
And that time is when I got curious about the trauma, the pain, the hunger that was happening in the workplace when somebody died of HIV, or when a family member died and we would go there to mourn with them. There was a bit of pain and hopelessness, helplessness, stigma.
There was
was
a
high.
lot of stigma.
There was a lot
You
of
would
stigma.
even go to help them bury,
You know?
because I know many would keep away because that was the time when they were being put in plastics or.
It was bad.
Yes, continue.
So that time I got interested and I asked God, what should I do? And that's how I started the journey of psychology.
Wow.
2003. Started with a diploma. Then, of course, it got interesting.
Yes.
And I think it got interesting also because at family level, being a firstborn, I've always been like a caregiver.
Okay.
So whatever would make me be a better caregiver, and knowing also in my family there is the predisposition of substance use.
Okay.
So I think I got interested in how I could be able to support my brother. I have a brother who struggles a bit with addiction and of course a mental health issue. So it got interested. So then I kept building, did my bachelor's, did my master's, and did my PhD in the same.
How many people know that? You know, because I see your passion.
Yeah, sure.
I see your involvement, and in the corporate spaces, and even in the schools and in the tertiary establishments. And I'd always ask, why is this lady? You know, there's always a why. So
True.
I really appreciate the way you've opened up and given us where it stemmed from.
Yeah.
And indeed, you are a caregiver naturally.
I am a caregiver. I've seen that a
Equipped.
lot, especially in the workplace.
Yeah.
I've supported a lot of, there are these units we call the HIV AIDS control units.
Yes.
In the AIDS control units, and various ministries and various institutions have been able to build capacity of many and encourage them also to be better in what they do. Because HIV for me was the game changer. That is where my journey in psychology began. And besides building capacity of the people who are doing it, I've also supported families. Of course, from the workplace, those that are maybe discordant couples, maybe a mother who is HIV positive, how can she ensure that she delivers a baby that is negative? And when I look at such people, I still get commendations from people there that you supported me. By the way, a family in Garissa.
Yes.
One time, while doing my work in Garissa, there's a couple that was really struggling, and they were all of them HIV positive. But then they said they really would have desired to have a child, and I supported them. Today they have a baby that they have named Pamela. in Garissa because of that support. So those are some of the things that really encourage me.
And
to do
you know,
this work.
I like what we're talking about HIV, but I also feel in this day and age, I think people forgot that the HIV still is there. They're not as keen as they were before, because today we are talking more on mental health. We are talking about this awareness. What is your take? Is it true that nowadays people, the attitude towards HIV, they're like, oh, there's medication, I can take my pills, and because of also the substance use, and it exposes you to irrational or you're inebriated, and therefore you at times you find someone doesn't use protection and all. What is your take on that, especially in a day and age like this? Mimi nasikianga Gen Z wanasema bora tembe than kulea, you know, something like that, which is worrying. What is your take on that?
Okay, today, you know, we have, science has really improved. Today the stigma is down because of the improvement in science. Remember those days that you could look at somebody who is HIV positive and you can almost tell, you know, those VCT amacho. You look at somebody like this and you are saying, this one looks like something wrong, you know. Today that doesn't exist anymore. People have been able to take their medication, adhere to their medication. Today we are talking about U is equal to U. Of course, if you adhere to the medication, your CD4 count goes high, your viral load goes low. So you are living a normal life, so undetectable. So because of low stigma, people kind of think that it is no problem anymore, but it still is there. When you look at the statistics from the National AIDS Control Council, the syndemic organization, the data is still speaking. It is not that HIV is over, only that at times, of course, the many things that are happening. At times people get confused. What do we deal with? Mental health now has come. Substance use is there. Climate change is a big monster again. But still, we really have to take care, because HIV is real.
It is.
The disease burden is high. And you remember that when one has HIV, their immunity is suppressed. So they are easily likely to contact any other disease, you know, because of a lowered immunity. So we cannot stop talking about HIV.
Wow, it's true. That one is well said. And so now you've gotten into this field of mental health. You studied. Can we link it? You know, you're a psychologist. You're a mental health champion. Can we now also see how ISSUP comes in, or this substance use? What is the International Substance Society of Substance Use Professionals, and what role do you play there?
The ISSUP is a global network of professionals in the space of substance use prevention, management across the world. It is a global network. Actually, currently we are in well over 43 countries. In Africa, we are in 8 countries, and each country has its members and of course the structure for leadership. So I'm privileged to be the president for the ISSUP-KENYA currently. We work through a board or committee that is the epitome for the country chapter.
Are they elective positions?
Yes, they're actually elective positions that every 3 years we do an election. And we have one given a responsibility to head the organization, and of course others support. What there is we are a network of professionals. ISSUP, when you look at substance use issues, they are not left to the medics only. It is an issue that concerns everybody. Everybody needs to understand. So as ISSUP, our membership draws from a multidisciplinary perspective, because nurses, doctors can join, teachers, the lay person, the faith-based people in the faith community, a parent who is interested to learn so that they can know how to even take care of their person or their next of kin who probably could be struggling with the substance use issues, psychologists, psychiatrists, you know. It is a whole multidisciplinary organ where we are categorized in 4 levels. We have the drug demand reduction. This is for the professionals who have done various courses from ISSUP. Then we have the regular membership. We have the student membership. And also we have another level, associate membership. So once you register to join ISSUP, then we are able, through the committee that is responsible for membership and registration, they are able to look at the qualifications and then classify you there. The good thing is you don't remain in one level because of the many curriculums that we have. We have the universal prevention curriculum, universal recovery curriculum, we have the universal treatment curriculum, and all of them are accessible to anyone. So the more you build your capacity, the more you progress.
Wow.
Yes, so we are a big organization currently with well over 2,000 members in Kenya.
How long has ISSUP been in Kenya?
In Kenya, we were registered in 2016 as an association.
So what I'm picking is you leave no one behind. As long as I'm interested in knowing about substance use, I can go on to ISSUP platforms and become a member.
Sure.
Is it free?
It is free.
Wow.
Registration is free.
Wow.
Yeah.
Wow.
And it's good that because of the curriculums that are there, because of the knowledge here, the opportunity also for you to express yourself and let people learn lived experiences, learn from a global platform. Because when you go to ISSUP global, you are able to access even activities that took place many years ago.
I've seen
Yeah,
that.
we have a newsletter, we have a journal, there's a lot of
YouTube
knowledge,
channel,
a YouTube
also,
channel, a place to grow. Is a place that we can really grow because substance use issues are complex issues.
It is true. For me, I acknowledge it because when I came into the field in 2022, God directed me in this path. I recovered from alcoholism. I had an alcohol use disorder, and so I was about 5 years in recovery, sober. And when now God told me, go and do this and this and this, the first thing I also remember was, number one, you didn't go to rehab, yes, but then it is a whole profession in itself. And ISSUP is one of the places I've acquired the knowledge. I am a member internationally and also the Kenyan chapter, and I've been able to do the online self-led courses. And so anyone who's watching here today, like Dr. Pamela has said, you could be a parent and you're concerned or you want information. You could be someone who has a substance use disorder and you want to know more about it. You're a professional somewhere, a nurse, a teacher, it doesn't matter who you are. You can be able to get onto that platform because it is the one that has helped me build. I didn't know addiction was a brain disease, but through the UTC and even UPC, that's the first education you get. What is addiction? And then also getting into there's something in the website. They tell you who is the community around you, so you can network with other professionals in that area. Maybe you're in Kenya, maybe you're in Uganda or these different countries. So I found it very beneficial to me. That's why I'm very privileged to say, I'm sitting with the president of ISSUP-KENYA chapter, and it is really impacting lives and people from all walks in the community where we are working can be able, through just a click to the computer or their phone, get that information.
In terms of capacity, when you say UPC is universal prevention curriculum, UTC is universal treatment curriculum, then there's universal recovery curriculum. We have each of them as like 8 modules, so you can choose which module to take. You can choose which area to specialize in, because today we are saying there are people who are in all aspects, but we wouldn't want to prepare a people that are prevention, a people that are treatment, a people that are recovery, so that then we can be able to specialize and be able to deliver in a better way. Besides, as you pointed out, Ms. Nkera, our trainings are online. You can do them self-led. There are others that are facilitator-led. At times we do face-to-face because you realize that the interaction is very, very beneficial. the experience sharing
Yes.
that at times happened face to face
Yes.
is more valued. But I'm not saying that the online ones you don't get.
Yes.
You really develop. Then remember the certificate that you get is a global certificate. Whatever certificate Nkera has is the one that somebody in India has, is the one that somebody in US who has done the same, somebody in Canada who has done the same, somebody in South Africa. We have a certificate that is
Universal.
you can actually be able to practice wherever if you find yourself there with that certificate.
Wow,
So it's universal curriculum.
I like the explanation. It's very clear. And you mentioned prevention. You've mentioned treatment and recovery and the importance for specialization. I remember, not even remember, every year there's IDADA, the International Day, against drugs and the trafficking, the illegal trafficking. And what has come out very strongly, especially these last 2 years, is to stop the stigma and to strengthen prevention. Can we talk a little about prevention and what that entails? Because I know you've talked about HIV prevention. I think that is your docket. Prevention. Prevention is better than cure, but it is also less expensive.
It is. Yeah.
Can we talk a little about this prevention and what you can advise in your capacity, and even as you continue explaining what we can do, as laymen or women or people watching this show today. What is prevention and what does it entail and what can be done?
I like the fact that you have said prevention is a science. It actually is a science. It's informed by evidences. It's scientific in the sense that research has been done to see what works, so that we stop doing things traditionally. We stop managing issues of substance use in a way that it's not recommended.
With no evidence.
With no evidence. So science, the science of prevention is very clear. There are those interventions that have been researched and found to work. Behavior therapy. What are the best ways to deal with the behavior? Because at the end of it, even as we look at the medical interventions, we also need to modify behavior so that then we can have less people initiating substance use. Prevention is key, because if we stop initiation of substance use, then we reduce the likelihood of people using, isn't it? Prevention also goes beyond even for the people who are already in use, but the person who is recovering, we have to prevent relapse. So it goes beyond even the person who has not initiated. We need to be able to help understand how to motivate people, motivation interviewing, so that then we can be able to help somebody realize what are the likely issues and how can they be able to be pulled out of substance when they are using. We need to be able to understand the therapies that are working, the medically assisted therapies. They are all scientifically proven to work. So the science of prevention is very clear. It is very important, because also when we look at the risks of one initiating substance use, and we look at the importance of understanding the science of prevention, we can be able to pick on the triggers. We can be able to pick on the underlying issues. We can be able to pick on the direction this person is taking, and we help them before they initiate substance, before they get to the level of getting addicted. So prevention is very, very important. And as you rightly pointed out, it is less costly. When we look at substance use disorders, they likely co-occur with the mental health, other mental health conditions like anxiety, like depression, schizophrenia, and the like. They likely co-occur with them. So when we understand the science, we can be able to pick out what is the issue. When we understand the science. In terms of prevention also, we know that people have other health conditions that could be triggered or could be influenced by use. So the health of the person is holistically looked at. It's not only that we are preventing, substance use.
Yeah.
We are preventing also other diseases that can set in because of use of substances, you know. And remember, use of drugs is not only the illegal drugs, even the prescription drugs,
which is now a
It's a
trend that
it's a
is
major
emerging,
challenge. Yes.
and many people are self-medicating.
Yeah.
Okay, yeah, just continue.
Yeah, so you look at prevention. When it's looked at holistically, it saves even families the trouble of treating. You know,
Yeah.
it helps the family to understand how can we be able to help ourselves so that we don't push one of us to use
Yes.
because of the things that are happening at the family level, especially when awareness is created. That is the role of the professionals, to be able to create awareness on prevention, to be able to create awareness on the psychological issues that could make one start using drugs
Yes.
or progress when they have already initiated. You know, we are able to look at the issues like trauma, you know, childhood traumas,
Yes.
the trauma that is happening because of the challenges people are going through today, the peer influence. So prevention is big.
Yeah.
Prevention cuts across.
Yes.
Prevention will help us stop initiation and also prevent relapse and the lapses that often occur. Yeah.
That's so well said. And in your capacity, you know, as then ISSUP president in Kenya, and with what is happening in this nation, as you have said, there's so much happening. And I like the fact that the last 2 years, or maybe 1.5 years, there's been a lot of conversations about the challenges Kenya face. Not that it was not happening before. Not that people were not getting treatment or prevention initiatives and all those programs were not going on. They were. They have. But then there's been a lot of awareness and a lot of activities in these recent times. What is ISSUP-KENYA doing to help in this kind of situation? And especially, I know you've shared about the curricula and the trainings and all that, but has there been a campaign or deliberate activities that you as an organization are doing in Kenya at a time such as this?
Great.
Yeah.
ISSUP does a lot of documentation.
Okay.
Yeah, we share knowledge.
Yes.
Knowledge that is not only generated locally, knowledge that is generated internationally.
Okay.
So that whatever evidences are being presented to the conferences that we go in, because you know ISSUP as biannual conferences
Yes.
that take place every 2 years. Recently we had one in Greece, which are global opportunities for scientists, for practitioners to come and present the findings. And then they are actually interrogated. And then what is proven to work is documented for the entire world to start practicing. So we share a lot of knowledge. Besides that, we collaborate. ISSUP cannot implement alone.
Okay.
We have to work with workplaces. We have to work with the community. The youth initiatives, very, very important. So collaboration for us is important. It is very key. We get to the community to create that awareness and say, as we create awareness, there is an institution that is doing this, because we may not be in that locality.
True.
But we link people to support. ISSUP also does research, encouraging professionals to do research so that we have a lot of documentary evidences that can be replicated. Besides that, supervision for the practitioners, so that amongst ourselves we can offer peer supervision. We supervise and mentor, so that at the end of the day we have a bigger mass of professionals, because we need people to understand the science of prevention. We need people to understand the science of addiction. So the more people are trained, the better. Professional development, very, very key.
Yes.
Mentorship, very key, especially now amongst the youth. We are currently recruiting the young people, because you realize Africa is like 70%
Yes.
is the young population.
It is.
And you see the vulnerabilities that they are faced with,
True.
to the likeliness of initiating substance use.
Yes.
So the more we tap in that group,
Yes.
the better. So we are reaching out to the youth
Yes.
to recruit them in ISSUP so that we can build their capacity,
Yes.
so that they can be able to influence the other young
Yes.
people, so they can understand addiction and themselves, first of all, not slide into it, and then they can be the mentors for the other young people in the community.
Wow, wow. But what we have also realized is there are many programs that are coming, and then immediately the people go back to the community. We've noticed a high relapse rate. Can you talk about that?
Okay, as I have pointed out before, substance use disorders are brain disorders. They are complex. They have underlying issues. They take long, some of them, to be diagnosed. Some of them have a biological causality. Others is because of the experiences that people are going through. So somebody goes for treatment. They are the only ones who have been supported. The family they are going back to has not been supported. The community they are going back to, there are no support networks. There are no groups that are ready to receive them, to help them to stay on course. So relapse often happens.
Yes.
The people out there do not understand this person. So the person has come from treatment. They were being treated badly because then they were people in addiction. They were maybe stealing to survive. They were fighting, they were like a misfit in the society. Now this person has gone to the rehab land, comes back, people are perceiving them the way they used to see them. So they feel comfortable that way. So they easily feel they don't belong. So likely be triggered back to use. That is one perspective. But also professionals. Who are these people who are offering support?
Exactly.
How many psychologists do we have? How many counselors do we have? How many psychiatrists, nurses, or even doctors do we have in this country that are able to actually diagnose early and diagnose correctly, so that this person is being treated for the real issue? Mental health issues are very complex, and they are almost kind of related.
Yes.
You'll hear people today talking about depression, but this person likely not having depression. You'll hear somebody talking about bipolar disorder. It's becoming like all of there people are talking, I have bipolar, but who has diagnosed you? So if somebody is not well diagnosed, then it means they are not getting the correct treatment. So the lack of professionals is a big challenge. Professionals also who may exist, but that they are not building their capacity. Maybe somebody just did a certificate or a 3-day course in addiction, and they think they can be able to manage a facility or be in a facility or be able to support somebody to a point of.
No, that one,
it's
that one is true. We
need professionals who have been trained.
Yes.
We need professionals who are continuously ensuring there is professional development.
Yes.
The science is changing. The new knowledge is being generated.
Yes.
Are they updating themselves so that you can be able to understand what is really happening? What is it that works? Does the family down there understand what is the likely cause of this substance use, so that we don't then trigger our significant other again to turn to substance use? So the gaps in structures, when you look at our facilities, in this country, how many facilities do we have that are dealing with substance use and mental disorders and properly so?
And are they accredited?
Are they accredited?
They are legally.
Do they have professionals who are qualified? Are they using the evidence-based interventions? And the number of facilities is a challenge. The social structures to support is a challenge. We need to be able to have proper structures so that our people can stay. We can prevent both before initiation and even after recovery, so that we don't have the lapses and the relapses that are really happening.
Wow. Professionalism
is key. Yeah.
And now we've had, you don't have to go for a 4-year course. You can equip yourself where you are as you plan on that journey.
Sure.
Let us talk about climate action and the relationship it has on mental health.
Yeah.
And because substance use disorders are classified as mental health disorders. Now that you're a professional in that field, just a little, tell us the relationship.
Okay. No, this is a space that many people have not touched in.
Yeah.
The mental health issues and in relation to climate. I make it very simple this way. Climate change or climate-induced disasters, droughts, floods, have people getting displaced.
Yes.
People lose their livelihoods. People lose their families. You know, you find a flood has come and swept a family. A mudslide has happened and buried.
Yeah.
You know, and drought has come and cleared all what the family knew as their resource base. They are left confused. They are worried. They are anxious. And people are developing mental health issues because of that. That is how climate is related to the mental health issues. The hopelessness, helplessness, the hunger, the low self-esteem. You look at a farmer who had 500 cattle.
Yes.
Because of a drought, they are left with 10. How do you explain to that man? That is what his esteem is. That is what he was supposed to use to take care of his family.
Yes.
Education-wise, the children will not go to school again. They are not able to take care of medication for their family. They are not able to run their family. So you find people getting hopeless, people feeling helpless. So that is how you relate. And people are actually developing mental health issues because of climate disasters.
Is there funding in that area? Okay, is that the question really?
But
then is there support? You know, because as we've spoken about climate change, climate action, and especially these few last years, and then also seeing the opportunities that come with climate action, in this space, is there support?
Okay, because it is gaining traction, the discussion around health and climate change, and especially mental health, is gaining some traction. And now there is need for research. There are few researches, because today we talk about evidence-based programming. If there is no evidence, nobody will channel their money there. So we are trying to generate evidence that links climate-induced disasters to mental health. And I have seen WHO is coming in strong that way. And once evidence is available, then funds can be channeled towards that. We can be able to tap on the UNCCC fund that is available for loss, loss and damage that is meant to be given to the developing countries that are actually suffering a lot the impact of climate change. So there are opportunities that are existing, but we need to focus the science that side. We need to have research, documented evidences, and even lived experiences, where you can be able to have people who are speaking to what is happening. I have engaged with the pastoral communities in Kenya. I've engaged with pastoral communities in Uganda and Ethiopia, and you find that this is becoming a big challenge. Soon we will be having an activity in Kajiado. We are bringing communities to appreciate the place of mental health that is climate induced. So the more people get awareness, the easier programs are run. Because of an activity I did in Kajiado, recently I was there and I'm told various radio programs and TV programs have been done where people are sharing their experiences.
Something they were not doing before.
People are not seeing
because of lack of awareness, and that awareness brought into light.
True. So the more we raise awareness, the better for our people.
Wow. As we conclude, I'd like you to share on the webinars that you normally have as ISSUP, and you mentioned you're an author. Are there books? Can we go look for them? Where can we find them? And then obviously the call to action, especially for the youth, to be champions, and to sign up and get in line.
Okay, ISSUP runs webinars virtually every month. We have like 3 or so webinars across the globe. And you just need to be a member of ISSUP. Then you log in and you participate in a webinar where we share knowledge. You find somebody presenting from Ukraine, somebody presenting from US, Canada, Africa, So those are opportunities to learn. And the good thing is, when you attend a webinar, the following day you have a certificate. I'm sure, Nkada, you have several of them.
Yeah, I have.
You have a certificate that you can actually say you are building your capacity. And you are able to gain knowledge and skill on what to do.
Yes.
Besides, in terms of workshops, in terms of conferences, we also have conferences that are taking place across the globe.
Okay.
In Africa, we are hoping by next year we should have a conference in Africa for Ostend in Africa, for us to be able to discuss this issue of substance use and substance prevention from an African context, because we need to contextualize the issues that concern us.
Yes.
When we look at our youth today, there are very many risks that they are faced with. Unemployment is one.
Yes.
Peer pressure is another. The fact that there's a lot of pressure on them, the society is putting a lot of pressure on these young people.
Yes.
Education itself, the many changes that are happening at times affect them. So we need to be able to have our youth understanding substance use, understanding this science, being able to know how can they protect themselves, what are the protective measures, what are the risks. And that's why I call our young people, not only in Kenya, but in Africa. We have courses that are available for the youth. Joining ISSUP is free.
Yes.
ISSUP-KENYA, your registration is free. We will classify you. We will be able to support you to build your capacity. You will be able to mentor and be mentored even within the profession, so that then you can be a change maker, a change agent within your society, within the universities, within our tertiary institutions, within our primary level institutions. Because you realize today, the youngest person who is initiating substance use, according to the research in Kenya, is 6 years.
Yes.
So 6 years, 8-year-olds are getting into substance use. So if we can have our young people join, so that we can grow their knowledge and skill to first of all take care of themselves, and then they'll be able to influence others not to enter into substance use.
Wow.
So my call to action is that mental health is an issue, and there is no health without mental health. So if we can be able to ensure that early diagnosis is done, and how can we do early diagnosis if we have the critical mass of professionals available to do this, and professionals who are building their capacity, so that we are intervening correctly, we are intervening consistently, we are using evidence-based interventions. So our country, our region in Africa, we need to harness the resource. The people of Africa, the people of Kenya are the resource that we have to have sustainable development. If we can stop initiation of substance use, if we can be able to help our people reduce use of substances, that will actually lead or have a relationship with even mental health issues and other non-communicable diseases. When the brain is affected, the body parts are affected. That's where you find somebody has a substance use disorder and has high blood pressure, substance use disorder and cancer, substance use disorder and diabetes. You know, all these health conditions are related. Let us join hands with prevent use of substances, because it's usually the initiation to use will lead spiral to other health conditions. Besides health conditions, we also need a productive people.
Yes.
Our society productivity is going low because of substance use. We are not tapping optimally on our youth, on our professionals, because you find because of substance use, always somebody is thinking, where do I get my substance?
Yes.
They are busy trying to recover from the use. So they are not being productive. For you are losing on productivity. So for having policies, improving on structures,
Yes.
if we can have to the lowest level of our dispensaries, psychologists, counselors, I urge our governments, our policymakers to plan for to have budgets that are targeting substance use prevention, that are targeting mental health issues, because primary health is very, very key.
Wow. Yeah. Thank you very much. Where can people find you? You know, Dr. Pamela is the number one, they call them prevention influencer. And the more of us who can be that, prevention, like we said, is very important. It cuts losses, you know, it does so much when we are able to prevent. Where can people find you?
Okay, I will say that for ISSUP, on our website, issup.net, we are also on Facebook. Personally, I'm on Facebook, I'm on LinkedIn, I'm also on Google Scholar, I'm on ResearchGate, I'm on Instagram as well.
Yes.
Yeah, and YouTube, the Mental Health Hub, where I share a lot of information about mental health, contextualizing it to various other aspects like spirituality, workplace, family, you know. Yeah.
Wow. There you have it, you know, with Dr. Pamela Kaithuru. Thank you so much for according us your time. I know you have learned. I know there are people who are writing down, and it is important. Rush to those websites, get that knowledge that is very beneficial for you, or even share it with someone. It is important that we prevent. It is important that we are aware. You know, many people are using assumptions, or due to culture and norm, they are using outdated practices, or assuming substance use is in a certain way, yet it is not. So get the right information, seek out for professional services, and always seek for that knowledge. Evidence-based. Evidence-based. Evidence means it has worked somewhere, science has put a tick on it, and that we can be able to prevent. And those people who were not able, you know, got initiated, there is recovery, there is treatment, and there is also professional support and a curriculum that is ready for you. Until next time, it's been your host, Miss Nkatha Mwenda, on Silent Conversations with Miss Nkatha, and we'll see you. Stay blessed, and God bless you.